The important word there, Fiona, networking. Do you know what that leads us to? Socialising.
Yeah, well, I
Yeah,
knew that was going to come up.
that's where John and I will certainly specialisation in that.
Welcome back to the Sports Dentistry Podcast. We made it anymore. We made it past episode 1.
Yes.
Didn't think it was possible.
No, I think there's been really good feedback since it's been released. What do you think?
It's been good. We've set ourselves up. Now we'll have to perform. We've built it up, and now it's up to us to step up to the plate. So hopefully we can really grow sports dentistry. This is another opportunity for us, to have a platform to grow sports dentistry, and the feedback from fellow sports dentists is that they're excited to see what they can do and what this can do and where it will lead. And it's up to us to start stepping up to the plate more.
Well, it must have gone really well because you've managed to brag yourself a trip to Tenerife. So you're currently in Tenerife doing it. So it must have gone really well.
We haven't even got the sponsors in yet.
No,
anybody does want to sponsor a podcast.
Especially if it's SPF 50.
Yeah, right.
So any sun creams out there that want to sponsor John specifically, then please get in touch.
I am the perfect model for a sun cream brand.
Absolutely.
We released the first podcast just as the Six Nations finished up. So how did the Six Nations go for you?
Yeah, ultimately, when we look back at now, France probably deserved to win. There was really good performances on Super Saturday. You being an Irish fan, probably disappointed in the end that didn't come out on top of the table, but there's really no arguments. France were really good throughout. I thought England put in a really strong performance as well and showed what they can do. They've got a really solid team, and Scotland, they finished on a high. But I would like to see Wales with time improve. I think everybody is used to seeing Wales putting in a really, really good performance, really good show. Obviously, they're going through a bit of a transition at the minute, and in the lead up to the Lions tour this summer, I think Maro Toji explained that a lot of the players know that that's in the back of their minds. So a lot of the performances that you saw really stepped up to the plate. I know we'll talk about the Lions in months to come, but it was really good to see some outstanding performances from many players across all the six nations. What do you think?
Yeah, it was good. It's good. Six Nations always provides great rugby. 3 teams with only 1 loss at the top. Ireland were very close. There was just one result. Didn't go their way. It was a tough day in Dublin, but if they had won the Six Nations, they would have broke a record. And last year they won the Six Nations and they almost won a Grand Slam. And if they had done that, they would have broke a record. So they're a very good level. It's such small margins at that top end of the sport. So, but the rugby is always great to watch. Six Nations, it always brings up. As you said, Wales are a little bit of that transition, and I'm sure Scotland are a little bit disappointed. They were maybe expecting better results, and Italy as well. They probably thought they could build on the number of wins they got last year. I suppose from their perspective, their home game against France, the scoreline didn't do a good reflection. But I actually had the pleasure of being in Rome last weekend for the Ireland-Italy match. And there's one thing about the Italians, they know how to party. So I don't know if anybody's ever been to the Stadio Olympia, but we were sitting at the match. We watched the match. Very competitive match. Atmosphere was great. We left the stadium, and it was as though we just had got a flight to Ibiza. We had a DJ Stevie Aoki on a stadium. The tunes were popping out. I'm not big into my music, but I tell you what, the tunes were banging. And everybody just left the stadium and gathered together. And it was just this big, massive outdoor nightclub. It actually took us a lot by surprise. And then after about an hour or so, the Italian team came out on the stage and it was absolutely fantastic. That was the first time I've been to an Italian rugby game in the Stadio Olympia, and we all left there thinking we want to come back. So definitely with the Six Nations, the rugby was good, and the Italian party was definitely good afterward.
Well, when you told me you were going to Rome and I hadn't heard from you after 24 hours, 48 hours, 72 hours, I really started to worry and panic. So I had to go into maybe put a missing persons report into the Italian police because you hadn't got back to me. And I was thinking, I don't know if he's okay. I don't. And then literally you messaged me between like thumbs up. I was like, are you alive? Thumbs up. And I was like, oh, okay, I'm at peace now. And then it took you another few more days or a few, like half a day or something just to get back to me. So
So just as a disclaimer, I was not there in a professional capacity. I was there with my school friends. We tried to get a trip together once a year, and it's usually about March. So about a year ago, we decided to use the Italian game, the Ireland playing Italy, and Italy as our weekend away. And the problem with getting together with your school friends is you feel like you're 17, 18 again. And then your body tells you the next day that you're not 17, 18 again. It takes about 3 days to get back to reality. So,
it's all very,
but
it's all very,
it was definitely a good weekend.
it's all very good at the time, isn't it? When you're
Yeah.
in a good space and you're with your best mates and things just kind of go. But that's what makes the memories. And like you said, Rome, we've been there before as well. And the hospitality you get from Italians is second to none. Their passion for rugby is so good, and that's why a lot of people want to see them do so well because it's a great place to visit. They bring a lot of support even when they're playing away games. Good blend of rugby. Just really want them to push on. More so just because we want to keep going back to Rome every
Yeah.
couple of years.
Yeah. And it's great because a few years ago there was question marks whether they should be in the tournament, and they really have been able to develop and turn that around, and they're being competitive and they're getting results the last couple of years. So that's fantastic to see. So yeah, Six Nations done and dusted. With the Lions coming up, obviously the clubs, from a rugby perspective, the clubs have still to finish off their seasons, and then with the excitement leading into a Lions tour this year. And of course, the women's Six Nations kicked off this weekend. It was really good initiative to run it separate to the men's, to give them their own platform. It's getting stronger and stronger every year. I believe you were at the Scotland game last night, Umar.
Yeah, I was there yesterday, so I took my daughter, who's going to be 6 in a couple of months, and we actually took her best friend. She'd never been to the rugby before, so I said to my wife, I was like, why don't we ask? Why don't we ask her if she wants to come? And it was a fantastic, fantastic day out. They've just put on such a good show, the Women's Six Nations, certainly at Murrayfield, and just the way that the players interact with the fans pre-match. They're in the zone thinking about the game, but they've still got time to high five and do some selfies and autographs and things like that. There's a really family orientated vibe when it comes to the Women's Six Nations, and having a little girl myself, it's amazing to see these amazing role models. And it was just honestly fantastic. And we walked away at the end of the game and both the girls were just so happy. And there were some really good photos taken by the official photographers that my friends had sent me today. And they can't stop talking about it today. My little girl was just couldn't stop talking about it, and she's got the program and she's got all the girls' names, and it's just, honestly, it was absolutely fantastic. And as you said there, it's great that they've got their own platform because they deserve it. The girls certainly deserve it. They're the players in their own rights. They have such skill, and there was so much skill on show yesterday. There was a fantastic game between Scotland and Wales. Scotland only won by 3 points in the end, but it was very much toing and froing. It was a fantastic testament to rugby as a whole, not just women's rugby.
And with the World Cup this year as well, this Six Nations will mean so much more to each of the teams. So I do believe the Irish women playing Italy in Italy next weekend. And if the Italian Rugby Federation can promise that there's the same party at the women's Six Nation Games as there is at the men's Six Nation Games, I'd be very tempted to head back over to Italy.
Absolutely. Why wouldn't it be though? I mean, they should be given the same amount of attention to the women's game that they do to the men's game, and it's only right and only fair that they get to experience it and the fans get to experience that as well. So maybe you'll have to go and tell us about it next week. I'm not sure your wife will be happy about that, but you got to do what you got to do for the job.
I don't think I have the brownie points, to be honest. I think I've used them up for a little while. I think it's very fitting then that our very first guest, we actually have a guest, so listeners will be glad to know, because they're probably almost sick of hearing from me and you at this stage, Humor, but they'll be glad to know we've got a guest on this episode, and there could be no better person from a sports dentistry perspective when we're talking about rugby and Six Nations than our next guest. And you know her better than me, Humor, so you may tell the crew who's coming on.
Yeah, I think, this next guest, like you said, has been instrumental, not just in my career to date, but sports dentistry worldwide. And I'm not just saying that because I know her so well, but if you speak to individuals from all over the world, they will recognize this name and they will know the amount of work she has put in behind the scenes, the amount of hard graft. I mean, she's gone through the dirt to get us to where we are, and 18 years have passed. And actually, she just recently did her last men's Six Nations game. And, I've got the pleasure of working with her, every week as well. And we talk a lot. And just her passion for sports dentistry and the passion that she has to take to the next level and to help us, promote that we are not just dentists. We don't just do teeth when it comes to being as part of the medical team. The stories that I'm sure she will allude to when we get her on, it will be fascinating to hear. And I'm sure there'll be a lot of people out there who will sit up and take notice and be thankful for what she's done for us and the fact that she will still continue to help us go forward. I'm super excited for the listeners to hear her story.
So we better tell them who it is.
Oh,
so
yeah.
I actually, yeah. So I got a phone call a few years ago from Thanos, and everybody in the sports dentistry world who Thanos is, and he'll hopefully be on as a guest one time. And he's saying, we're thinking about running a European Association for Sports Dentistry conference independent of ECOSIP, and we're wondering if you would help run it in the UK. I said, well, look, if you're looking to run it in the UK, yes, London is great, and there's lots of great sports dentistry done in London, but if you're looking for a venue outside London, there's only one person to call, and that person is Fiona Davidson. And Fiona Davidson got the call, and that conference was probably one of the best conferences I've been to, and that was down solely to the hard work of Fiona. And that just opened, I wouldn't have worked as closely with her in a sports dentistry sense as you have, because you work with her more, but it gave me an eye open into the work that she's done in Scotland over the years, building sports dentistry and developing sports dentistry. And before I got to know Fiona, I was quite envious of what she's been able to create in Scotland. So I'm really looking forward to hearing from her and hearing from her story and how she got started and her passion. And where now that she's actually retired from pitch side in Scotland, the future, because I'm sure she's not stepping aside from sports dentistry. I'm sure she's looking to keep actively involved. So I'm really looking forward to having in this chat.
She's definitely not stepping back in terms of just letting it happen on its own accord. She's very much going to be in the background and pulling some strings here and there, because she's got so many contacts in terms of not just within the sports dentistry world, but in the sports medicine world. And, she's so passionate. You will hear it from her voice that she just wants it to kind of take the world by storm. And like you said before, I've worked so closely with her, and you said you guys are envious of kind of what happens in Scotland. We talk about Scotland quite a lot, and we do on this podcast, but it's because she has led the way, and I'm sure a lot of people will agree with that. So yeah, I really hope we get some good feedback from the listeners for Fiona's perspective, and yeah, let's go for it.
Sounds good. So here we go. So it gives me great pleasure to welcome our first guest onto the Sports Dentistry podcast, the sports dentist, the myth, the legend that is Fiona Davidson. Welcome, Fiona.
Thank you very much, John.
So it's great. It's great, first of all, to have a guest, because I'm sure our listeners are already sick of listening to me and Umar, first of all. But I thought there was no better person to get on than yourself, because me and Umar spoke earlier about before I actually got to know you, I used to look from afar and be very jealous of what you've done and developed in this world of sports dentistry. And then when I got to know you, I understood where that came from, because I've seen that passion that you had for sports dentistry, and the hard work that you put into it, especially with the first conference we ran in Murrayfield. It was probably one of my favourite conferences I've ever attended. And I was able to see just what was the passion that you had for it, and why you were able to create such a platform for sports dentistry in Scotland. And I would be really interested to hear is where did that passion for sports dentistry first come from?
I think it stems from my passion for sport in general. I grew up with my father being a sports medic, an early day sports medic. He was a doctor for Bradford City Football Club, and I became passionate about football actually initially. Also loved playing sports. I played football myself as a young person, believe it or not, hockey, tennis. I'm now a bad golfer. So sport's always been a big part of my life. And then, of course, becoming a dentist, having the opportunity to combine my love of sport with my profession has been a wonderful experience for me over the last nearly 20 years.
And that's interesting, because everybody's probably got a similar reason why they've got into it, because their love of sports. But I think the challenge for a lot of people is actually getting into it. It was easy for Umar because he just gave you a call. But as one of the first people, like, how are you able to start sports dentistry? Or, like, I remember at undergrad there was no such thing as sports dentistry. There was doing a few mouth guards, and that was maybe about it. There was no sort of term sports dentistry. What was it like for yourself whenever you started to do a little bit of sports dentistry?
I think it was purely by chance. My dental practice, Smile Plus in Edinburgh, is very close to Murrayfield. One of my patients was the head of the ticket office at Murrayfield. And on one particular occasion, I gave him quite a lot of grief in terms of not being able to get tickets to the Calcutta Cup games at Murrayfield, to the extent he rang me the next day, and I actually thought he's going to make a complaint. I went too far here. You know, I've gone a little bit overboard with a patient. And he actually rang and said, Fiona, how would you like to be the dentist for the Scotland Rugby team? Which to me was like, pinch me now. It was like a dream come true. So I accepted that. Dr. James Robson, who recently retired as Chief Medical Officer of the Scottish Rugby Union, came to visit me. And then the next thing he said, would I cover the international matches, beginning with a pre-World Cup match actually against Ireland, Scotland versus Ireland in August 2007. So, of course, I was totally on cloud nine, thinking I was now in this amazing role. Turned up for the match with absolutely no clue about why I was there, really, or what I was supposed to do. Came crashing back down to earth, was totally unprepared for any emergencies, felt very peripheral to the medical team. And at that point, decided I really needed to find a way to expand my role and integrate properly into the medical team. So that was the start of my journey.
If you go back to what you just said there, you got in touch with somebody to say, look, I want to get some tickets for the Calcutta Cup. And then they actually approached you and said, actually, here, why don't you come and get involved and be the dentist? So if you hadn't to take that opportunity outside the box thinking, you know, I don't know where this is going to lead to, but the fact that that individual then said, actually, do you want to come on board? If you hadn't made that initial step, then none of this might have happened.
Exactly right, Uma. It's purely by chance. I wasn't expecting that to happen. I thought I'd gone completely overboard with a patient, inappropriately perhaps. You know, I'd been a little bit too pushy. And the result was he'd actually gone back, thought about it, and by chance has spoken to James Robson, who then, it was a chain of events. He recommended me to James Robson. And of course, luckily my practice was very close to Murrayfield Stadium, which also helps, of course. I had no experience in sports dentistry. It was very much in its infancy at that point. But obviously I grabbed the opportunity, and over the years I've kind of run with that, and it's really developed into something really quite special.
And that's interesting. Was it, I would want to know, who was the driver? Was it the head of ticket? It was like, how can I work a free ticket, or how can I get Fiona a ticket here? or was there an opportunity there already where the medical team were seeing there was an area there where they hadn't got cover for? Or was it maybe just a conversation of both? Was it just by chance maybe that the next day they had a ticket in that met James Robson and said, oh, I was at my dentist yesterday and they were complaining they couldn't get a ticket, and James Robson was like, oh, actually, we were thinking about trying to set up some sort of dental support. It'd be interesting to understand. Did you ever get a feeling of how it went from you saying I can't get a ticket to the guy then phoning and saying, oh, would you like to be a dentist? Did you ever understand what was the trigger?
It was purely by chance, John, because they'd had a dentist who I gather, and this is no disrespect to him, but he would turn up, say, hi, I'm here, disappear off to hospitality. The box was ticked that they had a dentist on site for the match as required. And presumably if somebody broke a tooth or there was a dental injury, they knew they had a dentist there that they could go find and get him to come and have a look. But the dentist wasn't really integral to the medical team, which is why when I turned up the first time and walked into the medical room, I felt completely out of place. It was a very bizarre feeling. And I knew straight away that I had to make sure that we could offer and be, offer our services in terms of all the particular skills we have, like suturing, facial injuries, things that we would have more expertise and knowledge about than the medics. I could see straight away there was definitely potential. And that was before we got into all the oral health of the players and everything else that we know is integral to sports dentistry. Just for that particular match day role, there was so much more I could do, even just have my own equipment on site, which we do now. There was nothing, and it made me feel very inadequate, really. So I knew I had to do something about it.
So how did you build on that? Then from that experience, feeling so out of your depth, what did you do to then create this brand that you've done now? Talk us through that period of time.
Well, the first thing was I went home and did some research, and I discovered that the only qualification that you could do in the UK anyway was the postgraduate certificate at the Eastman. And of course, that started in the September. So I got myself enrolled onto that year-long course as it was at the time. So it was one day a month down to London. A lot of it was to do with trauma. Obviously, the course at the time required more depth than it has presumably now. Obviously, it's grown into a master's qualification, but that was early days for that. It was very much pre the Olympics as well, 2012. So people were starting to think ahead towards that. So that was my initial port of call, was to get myself enrolled on that course and get myself understanding what sports dentistry was about as much as anything else, just to see what I could do. As part of that course, we went to Germany, to the Dreve factory, and learned how to make mouthguards. As a result of that, I also set up my own mouthguard laboratory. So basically learned a lot in that first few months, first year or so, and was very lucky with the support I had from Scottish Rugby and Dr. James Robson, in terms of he just had my back the whole time. He was very keen for me to be able to develop the role, which we have done over the years.
And if you split that role into two, so the one role is obviously being the sports dentist to the Scottish Rugby at the time and doing the field of play, which we'll get into, but also having the players come to see you for their routine care and for any trauma as well. So you break that up into two parts. With the field of play side of things, what do you feel helped you do that role?
Well, again, just the support of the match day medics, and I've got to know a lot of them extremely well. Started working with Edinburgh Rugby, who are one of the two professional teams in Scotland, who had a much smaller match day medical team at the time. So got more opportunity to do things like facial suturing, because we didn't have as big a medical team as you have at an international match. A lot of support. And then I dealt a lot with the head of medical services at Edinburgh and Scotland in terms of going in, educating players, trying to communicate well with the wider coaching staff and medical staff in terms of what we could offer, going in to do mouthguard impressions, at which time we did sometimes oral health screening, and then we could communicate with players encouraged them to come in and get proper checkups done and dental hygiene, gave them preferential rates. So we very much expanded the role fairly quickly in terms of what we could offer, improving oral health as well as, the more exciting pitchside role, which is what the initial job was.
With the pitchside role, the hospital care course, the scrum caps course that we do in Scotland, you feel that was essential?
Yes, the scrum, what they call scrum caps in Scotland, which is equivalent to World Rugby Level 3 now, but that didn't originally exist. That's a fairly recent development, partly developed by some of the Scotland medics like Johnny Hanson. I managed to get myself enrolled on that. It's really aimed at pitchside medics and physios. I actually wrote a chapter on maxillofacial injuries for that initial course, and I actually gave presentations on the initial course. But it was quite in depth, the presentations I was doing. So they've actually reduced that. So subsequently, I didn't present, but managed to get myself enrolled on the course. It's a pretty intensive 2-day course. You have to pass exams. And with that, it meant I had much more understanding about the immediate care with potential serious injuries on the rugby field. And I was able to be in a supportive role, understand looking after patients with concussion, helping to log roll patients who've got to be extricated from the pitch. So obviously as a dentist, we're never going to be leading that role, but it's very much a case that we are part of the team now, and we could potentially get called onto the pitch, which we have done. We've now got a bigger team, got 3 more dentists, including Umair, who have all carried out this training. And I'm about to leave this role, the pitchside role, and I realise it's in very good hands with my younger colleagues.
So from 18 years ago, where you walked in and you felt you were so out of depth, to now, where obviously just from the last few minutes where you've explained everything, how were you able to develop that? Like what I have found myself when I'm sometimes working with elite athletes, and especially when you go in and you feel out of your depth, you maybe have imposter syndrome. And as you said, you went and you got some education in UCL Eastman, and then you brought that education back. Sometimes you're almost afraid to say, I've learned something new, or, we could do it better this way, or I've seen this, and how did how were you able to develop that? Was it you would go back and with your relationship with the medical team, you would say, well, we could do this, or explain how them sort of steps? Because I do find sometimes when people first start working with teams, they feel, it's difficult, and maybe they feel like, we're the poor brother, and, and so how were you able to develop that from when you first went in, you said, we can do things better, but I also need to know more about what's going on, to when you started to learn more and get more experience and feel more confident to develop to what you have now?
It's very much an ongoing challenge, John. And I think going forward with sports dentistry, this is one of the things we've discussed before. We need to highlight, we really need to educate our medical colleagues regarding what we're able to offer, because there's still this fundamental feeling that we're just there to fix teeth and that's it. And actually we can do so much more than that. And what I've found over the years is certain medics I work with will give me a lot more responsibility than some of the other ones. And sometimes the younger medics are the ones that are less comfortable than some of the more experienced medics. I've been very lucky to work with Dr. Alistair Nicholl, who's a sports medicine consultant and has worked in the army. And Alistair, I think because of his army background and because I've worked with him for so long, will give me a lot of responsibility. He'll totally be happy in an international match to say, Fiona, you're in charge of all the suturing. If you can suture a vermilion border of a lip, you can suture an eyebrow or a scalp or a cut on somebody's arm. So he's happy. He will just let me take responsibility for that. You've got 15 minutes to get that patient, that player back on the pitch. So it's a joy to work with Alistair and some of the other medics. It can be more challenging when you encounter a doctor who's not worked with you before and you're almost back to square one. We're just there for teeth. So you do sometimes find having to prove yourself, even at my stage, at this late stage, trying to sort of prove myself. And I think that's one of our biggest challenges as sports dentists, is to overcome that and become known as specialists in our field.
You've been very open about that in the past, Fiona, about, medics, depending who's working with you at that time, whether they're going to have the confidence in you to be able to suture. We're dealing with dental related things every single day in clinic when it comes to teeth and blood and all that sort of stuff. So, we're so confident and comfortable doing facial oral stitching. So as you alluded to there with Alistair being amazing in terms of allowing you to do that sort of things, we still run into that now, especially with some of the medics who maybe feel that we're not adequately trained. And I think it's really important that we don't just, inverted commas, fix teeth. We can do all this sort of suturing. So it's really important that we still continue to build on that and build on the sports medics and healthcare professionals believing that we are an asset, because it's not just in the oral environment that we can provide valuable contributions to. And, having an extra pair of hands, having an extra pair of eyes, certainly pitch side and in the dugout when you are doing suturing and stitching, because we know that the time turnaround has to be relatively quick, and having somebody who's quite confident and being able to do that certainly then rubs off on the other medical staff as well. And they can really see that, and they kind of take that on board and say, actually, this individual is here to help, certainly, but they're also exceptional in terms of the skills that they have, the extra qualifications and training that they have to get to that point.
Well, I think so. I mean, my first 2 years when I graduated, I worked in maxillofacial surgery, actually at the Eastman and St Mary's in London. And back in the late 80s, showing my age, it was very much the case. We probably had much more responsibility than perhaps people do now. But that Max Fax background, any facial suturing when I was on call, did a 1 in 3 on call. So every third week, it was 24/7 for a whole week. So it was pretty intensive, but we would just get called to do any really difficult facial suturing because plastics and people were so busy themselves. So we just got very used to doing that and very skilled at doing that. And even though that's many years ago, that kind of never leaves you. But I do wonder, I think newly qualified dentists, to go into sports dentistry, we do need to have probably more structured training. The master's qualification is fantastic. That's the first one in the world that EMA has achieved. Obviously, John, you're a lecturer on that particular program. I think that's absolutely wonderful, but we maybe need to look at more practical training for young dentists who want to get involved, because it's not just the elite level. There's a lot of club games, school games going on every weekend all over the UK, all over the world, I guess, where dentists could get more involved and could actually offer their services. So things like facial suturing, if you can do it, wonderful, but you do need to have a recognised experience or qualification, and you do need to make sure that your indemnity covers you for that. That's the other thing. We've all spoken to our indemnity and made sure they know that we're doing this pitch side role.
Yeah, so with regards to suturing, I would actually got a good bit of experience suturing from a sports dentist point of view, but I wouldn't really have a lot of suturing, facial suturing like yourself from a Max Fax point of view. So with my first role into facial suturing, I did a physio course so physios are able to do a course that allows them to help out suturing, because as we know, it's brilliant when you have international rugby and so much support, but a lot of times at grassroots levels, the medical person there is the physio for the team. So I do find it's important. I think the biggest challenge is knowing your anatomy, because the anatomy is not what we're used to. But I also find it from having experience from suturing in the mouth and suturing on the face, that if a doctor doesn't feel that we have the confidence, we should be able to turn around and ask him, well, if you can suture, can you suture in the mouth? Because it's so much easier to suture an eyebrow than it is to suture a lower molar socket, where you're trying to push the tongue out of the way, you're trying to push the cheek out of the way, trying to keep the slave out of the way. It's important. it's out of our scope of practice as a normal dentist, but we have that skill set, and it's just ensuring that we get that extra little bit of education, that we know the anatomy, we know the areas that we can support and that we can't support. But it always after the experience that I've got, I always find it a little bit surprising when I maybe have a medical colleague that is surprised that we can suture, where it's even at undergrad you learn how to suture a socket. So it's just, we do have that skill set, but it's just being able to transfer that skill set in another area to help support our sports medical colleagues.
Yeah, I do think some sort of program where dentists can do a training to do facial suturing, to be a sports dentist, as you described, would be very, very important. I also think to leave the ego out of the room when you're doing these things, because obviously you want to get the player back on the pitch, but I've seen some pretty serious injuries, such as a boot going straight through from the outside through to the buccal mucosa, literally through and through. I've seen an injury to an ear where if you took the ear back, the cartilage was exposed, for example. So that player, I actually drove him into the A&E department, rang plastics ahead and said, I've got this guy, it's beyond. And the medics looked at it as well. We all agreed we needed to go to a specialist to be dealt with. So you've got to also be able to assess what you can reasonably treat before you attempt something like that. So definitely you've got to be very, very careful. And, would emphasize the indemnity as well for any dentists who are listening. Make sure that you are covered before you start offering to do these things, which is why we probably need to, as an association, which we'll talk about, I know, Uma, in a moment, but we need to look at running some of these courses, I think, that can be accredited.
Yeah, I think you're right. If you know what's in your scope of practice and being able to identify what you can't do pitch side and being like, okay, well, this is actually needs more specialist care, whether it's max fax, whether it's plastics, and being able to, because like you said, leave the ego at the door. It's all very well saying, I can do these sutures and all this sort of stuff, but you have to have the athlete's best interest at heart, because we need to also consider things like scarring, secondary infection. We need to make sure that the wound is completely clean. So there's so much other things that we have to consider. And I think that's the most important thing is, and also the healthcare professionals and the medics will appreciate the fact that actually this person knows the scope of practice and they know they're not trying to, be super man or woman and trying to do something out with their comfort zone. They can actually put their hand up and say, I need more, or we need more specialist input here. So I think that's super, super crucial.
I think that's true. The other one would be facial fractures. We don't see it very often, luckily, but I have seen mandibular zygomatic arch fractures. And I think we're probably more qualified to recognize these things, perhaps clinically, than our medical colleagues. So again, you can see a step in the occlusion, lots of bleeding, discomfort from a mandibular fracture, for example. But at least as dentists, we can then phone through to the A&E, speak to the on-call MaxFax SHO or equivalent these days, and actually get them seen straight away, rather than the player going and sitting for 4 hours in A&E. So it's quite useful with our skills to be able to refer people in quickly for emergency treatment to hospital.
So you've demonstrated very well there how important it is to have that great relationship with the medical team, so they know what you can do and what you can support and what the next steps are if it's not. So is that something that you would sit down and have a conversation about? So like, say for example, if you are supporting suturing, do the medical team know this is a certain thing that can be supported by the sport dentist, or this is not a thing that can be supported by the sports dentist? Do you have them conversations? Like, how's it? You don't, obviously don't just turn up on match day and the last time you seen the medic last match day, or how do you develop that relationship where your sports medicine doc knows when they can call on you and etc.?
That's a very good point. It's actually different every single game, whether it's an international or a club game. We have a meeting about an hour before the match starts, and there's a match day doctor, and everybody's introduced around the room. And it's often the match day doctor will determine who does what particular role. And usually it is suturing in my case, as well as any oral injuries or facial injuries. And we always offer to the opposing team the option of me or the medical person suturing. And sometimes they do take that up, sometimes they don't. I have sutured certainly a Welsh international and an English international, but not when they were playing for their national teams, when they were playing for club teams. You do tend to find international matches, they do prefer to do their own suturing. I think they're just worried that you're not going to get them on the pitch quickly and things like that. Not that we would be so unprofessional, but there's always a bit more tension, I think, in an international game and a bigger medical team as well.
Yeah, and when I did the Scotland-Italy game just in the Six Nations there was actually 4 Italians who came off with lacerations. And, you've got the blood injury time, and they definitely cut that short because the physio was coming in and saying, you've got 3 minutes left. We're like, no, we've got another 8 minutes left. No, 3 minutes. Player needs to come back on. So, it is at that level, and they were playing great at the time as well. So they want the players back on as soon as possible, and you are under pressure. It's their local anaesthetic and actually a lot of the players don't want local anaesthetic during the game. They just want you to get in and put the sutures in right away. And you can see them wince a little bit, but because they've got so much adrenaline going through their body, they just say, just go, I want to get back out. So yeah, the pressure is on, especially during match play. Obviously after the end of the game, you've got a bit more time, but they just want to stop the bleeding, get them back on the pitch.
Indeed. And sometimes it's not till you get there, you find out who the matchday medical team is, and you don't always know for sure until that meeting an hour beforehand exactly what your role will be. But again, leave the ego out the room. If I end up cleaning up after someone else, cleaning the floor, wiping blood off things, then that's fine. As far as I'm concerned, I'm part of the team. If I get to do the fancy stuff, that's grand. But if I get to clear up after someone else, that's also fine. But it is nice to be given the responsibility.
Yeah, so it's really important, that relationship that you have with the medical team and everybody knowing their role and their scope of practice. And so you've went from yourself walking in to get a free ticket in 2007 to now building a team of support. How did that develop from Scotland Rugby into then maybe the clubs, and then developing actually a sports dentistry team to help support Scottish Rugby?
Well, for a long time it was me, and then my colleague Dave Connaty came. He's my kind of vintage. Dave came along and helped, and he worked at the Olympics as a dentist there, and he's worked at various other games, so he's very experienced. And then actually Umar approached me about 10 years ago, and just out the blue, and asked how he could get involved. So he came along and shadowed me initially, and then I kind of, probably too grand a word to say I mentored Umar, but I've always tried to support him over the years. And obviously he's developed very much into a sports dentist, one of the first graduates from the master's course at UCL. And my other colleague, Azzy. So there's a team of 4 of us at the moment. I'm going to retire from the pitchside role at the end of this season. So we've got another young dentist coming in. And that's kind of my legacy. That's what I wanted to leave. I didn't want to sort of be Fiona, do my thing and then move on, and then there was nothing in place. So I'm very glad that we've developed the role between us. We've got great ideas going forward regarding screening, supporting the athletes going forwards, plus they will continue with the pitchside role. So yeah, I'm glad it's kind of developed into a bigger role, and my younger colleagues can take it forward. And I'm rambling now.
You've been in the business 18 years, Fiona, and I've been with you the last decade, like you said, and I've seen the growth in that last 10 years. So I can only imagine what it was like from year 1 to year 8 when I got involved, and you certainly have mentored me and you've taken me under your wing, and it's very public knowledge, I don't beat around the bush. I love you to bits, and you've done everything for me to where I am now. And if it wasn't for you, I wouldn't be where I am. But it's not just me. It's like you said, it's Azzy, it's Dave, it's John, who you're inspiring. There's lots of amazing names out there that we can talk about, but not just in the UK, worldwide. There's people who, have been messaging us when we've been saying, who do you want on the podcast? And there's been lots and lots of people saying Fiona Davidson. So from South America, from India, Australia. People know you, Fiona, for what you've done. I know you want to kind of slip under the radar, but you need the recognition, because hopefully from here on in, you'll be able to see just how we're going to grow. And you're very much going to be part of that still, where, you're quite adamant that you want to still be involved, maybe not on the front line, so to speak, but certainly with Sports Dentistry Association that we'll touch on going forward. But you certainly have been instrumental with that as well, and doing the European Association a couple of years ago too. So we have to certainly sit up and applaud you for what you've done, and talk us through your emotions. You said you did your last men's Six Nations game, Scotland versus Wales. Talk us through your emotions that day.
Oh, I just had a knot in my stomach, really. Gosh, makes me want to cry just thinking about it. I kind of knew every 2 years we have to do the Scrum Caps, the World Rugby Level 3 equivalent course. And it is very tough, Umar. You've done it a few times now as well. It's a 2-day course. You've got to do quite a lot of preparation beforehand. You've got to do a scenario on the day, a potentially life-threatening scenario, and that's examined in exam conditions. You've got to do a sit-down exam on the day. And I said 2 years ago, that's it, I'm not doing this again. So I knew it's not been a sudden snap decision. I've kind of made the decision and have gradually reduced the number of matches I've covered as you have increased the number of matches you cover. So yeah, I was prepared for it, but it was emotional, and it still hasn't hit me because it's been such a massive part of my life.
I'm sure Fiona was very emotional, but it's very misleading at the moment, because we've done a lot of talking about pitch side support for Scottish Rugby, and you doing the last pitch side support, but you'd almost think that's the only sports dentistry you do, but you do lots more sports dentistry, and you do more than rugby. I know we spoke a lot about rugby because the men's Six Nations have just finished, and it's very much on the radar. But you've worked with a lot of other sports, and you do a lot of sports dentistry out of your clinic. Tell us a little bit about that.
Yeah, we do get referred patients from the Scottish Institute of Sport. So we're talking about athletes who maybe are competing in the Olympics, for example. So we do get referred patients from there. We do get a lot of patients in the clinic. Obviously, Uma works in my clinic as well. So coming through cricket, football, different sports, athletics. So we have become known really within the world of sport in Scotland as the go-to dentist, or one of the go-to dentists for sports dentistry. And we're able to support. But as we'll all know, all of us who work in sports dentistry know, we do have a challenge trying to convince athletes how important it is to look after their oral health. And I often talk to them about that extra 1%. You need to, if you want to win a gold medal at the Olympics, not just come in the top 20, that may make the difference, having good oral health, not having gum disease, not having a carious lesion in your tooth that's a necrotic tooth that they don't know about, for example. So we all are learning more and more about bacteremia and the role in general health, for example. There's a lot to learn, I think, in sports dentistry about the impact of poor oral health. And I think that's really where we are at the moment in terms of research. But that's the message I try and get through to my sports patients, all my patients, about the value of having good oral health. But I think that is the biggest challenge, apart from convincing the medics I talked about earlier. But I think that's a massive challenge generally in sport, is trying to educate the medics and educate the athletes about improving oral health.
Yeah, we do find, you're actually always on call, inverted commas. So, we'll get a message either from the athlete or from the medic or the physio saying this player has got this problem and we are flying out tomorrow, or they've got a competition this weekend. And we've said, look, we've maybe explained to the athlete previously during screening that they needed X, Y, and Z done. And now all of a sudden you're trying to scrap around and make space in your book to try and see them. And you want to try and help as much as you can. So there is a battle with that. I mean, you can lead a duck to water, but it's the education part of it to say this is what will happen if you do not get X, Y, and Z done. And you have to be conscious of training times, competition times. So, and at times they have available to actually come in, and recovery times. So it's education is paramount, I believe. And then prevention goes with that as well. But I certainly feel as being a sports dentist, you're always on call.
I think you're absolutely right. And it can be infuriating. And sometimes it'll be a patient who you have seen and you've said you've got a chronic abscess on a tooth. And I know of one case at the moment. So chronic abscess on a tooth, we don't know what impact that's having on your general health. It can be that 1% we talked about. It could flare up into acute abscess when you've got a big competition the next day. And then you're not going to be able to compete at the right level. You're going to be in pain, etc., etc. And it can be infuriating because I do know of cases, and you're right, Uma, suddenly they're under stress because they've got a competition, and that's when the thing does flare up and they have a bad episode, whether it's pericoronitis or a chronic infection on a necrotic pulp or whatever it might be. So yeah, that screening is really, really important. And when I do go in and give presentations to the players, it's usually a 10-minute presentation. Any more than that, and you can see they switch off. 10 slides and it's scary things. And I go in and tell them scary things and over egg it a little bit to try and make them come in, because generally they don't. They tend, because they're elite athletes, they're healthy, they're fit, they're strong, and they do neglect their mouths. And we're all seeing that, I think. And I think this is a thing. But again, this comes back to educating the medics, really impressing on the medical team how important it is to get these girls and boys in to get their teeth checked and have any treatments required.
So, where do you see the future then? How do you feel sports dentistry is going to evolve?
Well, this is key, isn't it? We need to get the medics on board. We need to get into the training grounds. We need to do screening. Screening isn't as thorough as getting them into the surgery and doing x-rays and having proper lighting. But at least if we can do a screening session, 10, 15 minutes per player, ideally a little bit longer, even just speaking to them, hopefully some of them will come into the practice, come and see you, actually get proper examinations done, have any treatment done. All the research is showing that when screenings are done for research purposes, that oral health is generally quite poor in elite athletes, certainly. So that's key. We need to educate the medics, and we need to get oral health standards improved in athletes and elite rugby players and football players, etc. And then obviously the pitch side role, I'd like to see more people taking part in that. And I'd like to see us have more of a training pathway, not just the master's program, but simple courses that people can take in order to give them the qualifications that they can go to their defence organisation and be covered to offer those skills.
So education is a big thing then, and you've been instrumental in setting up the UK Sports Dentistry Association, and that's probably one of the drivers where you felt we needed this platform in the UK, obviously to bring sports dentists together, but also to provide a platform for education. Like, how do you see that evolving? Like, your education, do you feel the education for sports dentists need to come from the sport, or does it need to come from how do you, obviously there's the universal academic role, like we spoke about the masters, but you feel that there's almost like is it like an introductory role, or is it like how do you see that evolve or make it more accessible to get people the education that they need?
I think making it accessible is really interesting and really important, John, because we're a small group. We all know each other in the UK, people who are involved in sports dentistry. And most of the people we know are on the committee that we formed. And obviously worldwide, particularly you tend to go further afield to some of the conferences in America and Europe and everywhere else. So worldwide, it's a pretty small niche group of people, but we don't want that. We want to expand that. Dentistry as such can be quite boring if you're just putting amalgam in teeth or whatever you do on the NHS day in, day out. So for me, it's made my job incredibly interesting because it's combined my job with my love of sport. And I know lots of people out there, whether they're good at sport or not themselves, really love sport and want to get involved. There's the mums and dads who are dentists who might be involved in their kids' school team or club team, for example. So we don't all have to be doing it at the elite level, but there's so many opportunities at every single level where dentists can offer their skills and get involved. But then there's also the excitement of getting involved in things like the Olympic Games, Commonwealth Games. Next one's coming to Glasgow, I think, next year. Yeah. So, and dentists can volunteer to be involved. I've done a Commonwealth Games a few years ago. I know you guys did the Birmingham one. So makes the job much more interesting. But I do think the association has got a lot of potential in terms of growing this role and offering some sorts of training courses, but also networking. We don't want to be just this closed little group. There's so much potential for so many people to get involved. And I'm really pleased we've got a student member of the committee, and we've got a lot of students interested. I know Uma and I are going to maybe look at doing a road trip where we go to some of the universities and give presentations to final year students as well. I really want people to be excited about this and get involved.
The important word there, Fiona, networking. Do you know what that leads us to? Socialising.
Yeah, well, I knew that was going to come up.
that's where John and I will certainly specialisation in that. But yeah, no, you're right, because like-minded people will go to these courses and they'll make the connections and they'll hear the stories and you feed off each other, and then when you leave the conference, you've got this extra spring in your step to be, okay, this is what we're going to do, this is what we need to achieve. So it really needs to be open to so many people, because we want to build this family essentially together and just see where it can kind of take us. And if we can be a positive role model or leave a positive idea in someone's head, something that we maybe not thought about, and they can come and say, actually, have you thought of this, have you thought of that? And it will really can create this sort of domino effect where before you know it, it's kind of just growing and growing and everybody's working together for the greater good.
I agree. And the social aspect is really important as well. You're quite right, joking aside with the networking, obviously you're going to talk a little bit about the conference, but the last conference we had in Edinburgh, it was great. We had some great speakers. We had, a lovely dinner in the evening. Those that were interested came to the Scotland-Portugal game at Murrayfield the next day. So we had a couple of days of really good networking with like-minded individuals. There were the oldies like me and Professor Peter Fine, who we haven't mentioned as yet, but, he's chairman of the association. Dave, we mentioned. So down to students there, we had all ages and it worked really, really well. It was great fun.
Socializing is very important. But I think it gives us a good chance as well of an opportunity. We spoke about how we've been very fortunate to have the ability to work with a lot of elite athletes, and as you said, Fiona, you've spoke about like working with Scotland and your chance to do the Commonwealths, and myself and Umar have had great experiences as well. But you mentioned something there. It's every dentist probably has a child that plays sports. And if they give them the confidence, if they're watching their child play sports and someone was to have contact which led to oral facial trauma, that they would feel comfortable to be able to provide that support. And I think, yeah, it's fantastic that we've been able to develop this sports dentistry and start working with elite athletes and things like that. But really, the future would be at community level, at grassroots level, that if there was or facial trauma and a dentist was on the sideline maybe watching their child's match, that they would have the confidence then to be able to support that person receiving the trauma. Is that how you feel?
I think it's important, but I think that there perhaps needs to be a pathway where people who are really serious about it can ultimately, work at the elite level as well. So there's two strands to that. There are the cases where there's further training available and mum or dad who's a dentist can do that and then feel comfortable within that community level or school level. But there should be some sort of training pathway. So if you want to become the dentist for, and I think all elite teams, whether it's an Institute of Sport or whether it's a rugby team or Manchester United or whoever, who probably do have a dentist, but I'm not sure that every club, whether it's rugby or football or whatever, or hockey, for example, is another one where they get dental injuries. I'm not sure they do all have dentists, and there's possibly not enough dentists to go around to do all of that. But the more people we can get involved, the better, I think.
I think it's about being able to put your hand out there and say that you are available. And like we said before about being on call, in inverted commas, all the time, is to say, look, I am a dentist who has a special interest in sports dentistry. I can offer you X, Y, and Z. Please distribute my number among the clubs in this area, and then people can then contact you. I think that's probably the best way to go about it. And I think we also have to plug Dental Trauma UK here, because they are obviously teamed up with us with the UK Sports Dentistry Association, and Serpil's done an amazing job on that website, and you've got access to all the information that you need, and kind of step by step of each individual injury as well. So you can watch it and you can learn from that as well. And you can also link to the International Dental Traumatology website as well. So that's not just for dentists, it's also for the medical team as well. So I think it's really important to have these partnerships where, you know, when you are pitch side, something does happen, certainly at amateur level, like, do not panic, because there is information available that you can access right away. And I think it's crucial that the people listening to this know that there is information available for dental trauma, orofacial trauma, and Serpil's done an amazing job with regards to that. So we definitely need to plug that as well.
I agree. It's fantastic. The Dental Trauma UK website is probably something our own association would be very jealous if we can get to that level from a sports dentistry perspective. So socialising, we've decided the next conference to go to the cricket instead of the rugby. What I really want to know is, do you think the cricket would be able to live up to how good rugby is to socialise at?
Well, obviously, Umair's the cricketer here, not me, but I don't think if he told me how to go to a 5-day test match, that would not do it for me. But T20 cricket, it's a bit like sevens rugby. I think anybody can get excited by that. So I think a couple of glasses of wine in the evening and watch the cricket sounds like a good night out for me.
Yeah, I think we're extremely lucky that the conference is going to be in Manchester, and you know the level of sport on show, again, it's going to be international standard with England and South Africa, and people will be able to certainly have access to really good educational content during the day, should we say, leading on to the dinner and the event itself. So really, you know, the T20 is only 3 hours long, so it's not a case of we're going to be watching 5 days of test cricket, which obviously which is what I would love to do. But I think narrowing it down, high impact, intensity, international sport, and we'll change it every year. We're not just going to do rugby. We're not just going to do cricket. We are going to spice it up. We're going to take it around the country. And I think this is a really good second conference that we're going to have, and within the next week or two we'll be hopefully nailing on the presenters and for that course, and the ticket should hopefully be live pretty soon. John,
you put me under pressure here, Umar. We'll work out tickets whenever we're ready to launch. I spoke the last time, although we talk about the socialisation and the education of the conference, the networking is really good as well. And for anybody that goes to the next conference, I spoke about in the last podcast about how them small conversations, you can get some great information. So don't be afraid to rock up to Fiona and say, I heard you in the podcast and would like to ask you about this and like to ask you about that. But I'd like to know, Fiona, what's your favourite memories from working with athletes? Is there any athlete, was there any rugby player or any other athlete or from any other sport where you had an experience with where that sticks out in your mind as one of your favourite moments of being a sports dentist?
Oh gosh, there's so many really, and so many players that I've encountered and had the pleasure of working with. And on the whole, they've all been great, you know, the women and the men, just incredible, inspirational characters. I mean, some people like Rachel Malcolm, who is the Scotland women captain currently, is just, you know, there's so many Instagram influencers these days, you know, for young women to look at, and you cringe, you know, as I have a daughter and 2 granddaughters, and it worries me, particularly, you know, the granddaughters are very young at the moment when you see some of the influencers, but somebody like Rachel is just, you know, I think she's doing a PhD or something, you know, she's super clever. She plays for Loughborough Lightning. She captains Scotland. She's an incredibly nice person to talk to. And, you know, I'm in awe of somebody like that. Memories, funny one. I don't know if you remember the player Chabal, was it played for France? With the beard, he used to smoke the gauloises at the side of the pitch.
Yes.
Yeah.
He was
a
he
character.
was a sex icon in the Rugby World Cup at
Yeah,
2007, wasn't he?
yeah. Yeah, so going back quite a long time ago, he played for what was Racing 92, as Racing Metro, played Edinburgh Rugby, and this was a knockout game for the Challenge or Champions Cup, European Champions Cup. And Tim Visser, who was playing for Scotland, well, wasn't playing for Scotland, he wasn't qualified quite at the time. I think they were about 40 points up, Racing, and with about 20 minutes to go. And then suddenly Tim Visser started scoring tries. And I ended up in the medical room for some reason with Chabal and the physio, somebody stitching him up. And they were just speaking very quickly in French. And then he suddenly turned to me and went, "Who is 11?" And this was Tim Visser, but that might not be relevant for this particular podcast because it's historical, but it was funny at the time. But other players, I mean, my current favourite player would be Darcy Graham. I think is just loves life, loves playing rugby, and is just a delightful young man. So I'm praying he gets a Lions call up. But there's been other great ones over the years. On the whole, I just love it. Brilliant.
Fantastic. And any plans this year? Have you any big sporting events you're going to go to, or is there anything you're looking really forward to?
Well, obviously the conference, I'm looking forward to that. But sporting events for me, it's still rugby. Still get my season tickets. Still be going to the matches, even if I'm not actually working at them. So I'll be watching in a different way. Won't be watching to see if somebody's got head injury or bleeding or whatever, which is what happens when you're on duty. So it'll be just good fun. Yeah, but any sport, I'll always watch sports on the TV, anything that's going on, really. Love my golf, terrible at it, but, love watching the golf as well.
That's fantastic. I think that would do us for this podcast. I think, Fiona, as a first guest, you've been absolutely fantastic. You have a wealth of experience, and what you've done for sports dentistry, you really have set a standard that people want to get to, and it's absolutely fantastic. Thank you very much for coming on to share your experiences.
Thank you so much.
I absolutely agree, Fiona. Thank you so much for taking the time out to speak to us. And like John said there at the conference on Friday, the 12th of September, if you're there, please approach Fiona. She's very, very approachable. She'll be more than happy to answer your questions, I'm sure.
Absolutely. Thank you so much.
Thank you.
Thank you. Well, that was a great interview, Raymore. One of the leaders in sports dentistry. It was always someone that everybody spoke so highly of. They were always in awe of what she was able to create up in Scotland. And it was great to hear from herself and really about her, what she's developed. And I'm sure the listeners will have heard that passion that she has. It comes across, it oozes out of her, the passion she has in sports dentistry. And she's a great role model for anybody looking to develop their sports dentistry skills and become more involved in sports dentistry.
Yeah, absolutely. You can hear it in her voice, can't you? That she just loves it. She loves everything about it. And, she loves the fact that it was difficult to start with, but she managed to create this environment where the medics and the healthcare professionals were able to stand up and take notice of her. She still believes that there's a lot of work to be done, and she alluded to that as well. Yeah, I think that will touch a lot of people in terms of how they go about in their own careers and how they're going to try and elevate sports dentistry wherever they are in the world, and look at her journey and really to them, because they might be somewhere in a country where there's no sports dentistry and they're where Fiona was 18 years ago, and they're going to take a leaf out of her book and be like, okay, well, this is what she did all that time ago. Now it's time for me to do it here, because there'll be many countries out there, many listeners out there who just don't know where to start, and they'll listen to this podcast, they'll listen to what Fiona did, and then they can be that Fiona in that country. And that's what we're here for. We're here to give them that advice, give them that information, that platform to believe in themselves and to believe that they can make a difference.
And as you mentioned, so approachable. So if anybody is listening to the podcast, don't be afraid to reach out to her, whether it's at the conference in September or if you're international, shoot her a message. She said that's how you got more involved. He just reached out and she ended up becoming his mentor, which is a little bit like me in this podcast. I'm consider myself a little bit of your mentor.
You're a mentor. You lead me on the right path, I'm sure, mate. But no, I think it's important to tell people that they can get in touch with us as well. Please feel free to message myself or John. And if there's anything you want to ask, any questions that you have, we are on. All jokes aside, we are approachable, and we do have a lot of knowledge, but we will also gain knowledge from you, the listener, as well. So we are open books. We would love to hear from you. Please follow and share our page if you have any suggestions, if there's anybody in particular that you want us to speak to, if there's anything that you want us to speak about, please leave the suggestions in the comment boxes, and we'll continue to bring the banter. I'm sure we'll find out about John's holiday in Tenerife. We'll find out if he got any sunburn. We'll find out lots and lots and lots of stories about him, I'm sure, this week. So please listen to the next episode when it comes out.
So I think we've done pretty well. Our first episode with a guest, as we said last week, and our first two things will get better, and I'm sure our interview skills will get a whole lot better as the more experienced we are. And I've got a feeling, Umar, I'm starting to get a little bit confident, and it might be the fact that I'm in Tenerife, but I think for our third episode, we should go international. I think where we should go. I think we're ready to go. We spoke a lot about the UK. We spoke a lot about rugby. I think it's time to switch it up. I think we should go international and let's go. The only way is up.
Yeah, I think we need to go international. Let's go, man. Let's go for it. I think there's no holds bar. I think what's the worst that can happen? The podcast gets shut down, and that's it, done, man. But
so I'm sure we can find somewhere that will be some dentist that's in a place that would suit our sociability. So listen in to see who we've gone at our next podcast.
Do you know what I'd also like to just say is if anybody's got any suggestions of somewhere where John and I could potentially do a podcast in person together, we are open to travel. It could be anywhere in the UK. It could be anywhere in Europe. It could be anywhere in the world, but you'll have to give us notice so we can get the pass from the better halves.
Yes. It will take a little bit of time before I have enough brownie points to travel again.
We'll go well in Tenerife this week and build those brownie points up.
Yeah. Good, man.
All the best, buddy.
Great. Thanks very much for listening. We'll see you the next time. See you again.
Cheers, guys. See you later, buddy.